Hi, everyone, and welcome. We are so thrilled that you have decided to spend an hour with us this evening. My name is Maureen Kelly, and I am going to be part of a cross-departmental team talking to you about some of our success stories and challenges in creating transgender, non-binary, and gender expansive, inclusive workplaces at Planned Parenthood Federation of America. I'm joined by a number of folks, and I would love to invite Brooke to hop on screen and introduce themselves as we get started.
Hi, everyone. My name is Brooke Bax. I use they, them pronouns. I'm the Digital Innovations Manager at Planned Parenthood Federation of America, and for the purposes of this call, have served on leadership with our Pride Employee Resource Group for the past 2 years.
And Bianca.
Hi, everyone. My name is Bianca Mays. My pronouns are she, Aya. I am the Associate Director at PPFA.
Great, and George.
George, if you could unmute yourself, please.
There we go. So all my funny jokes just went out the window, but I'm here and I'm excited to be a part of it. And I am the Chief Equity Officer at Planned Parenthood.
Fantastic. And like I said, my name is Maureen Kelly. I am currently serving as our advocacy officer on the Pride ERG, and my day role is in training and learning design. I'll take the next slide, Jenny. Some of the things that we are going to talk with you about and share today include talking a little bit about a foundation and a framework that's been really critical in the work at Planned Parenthood, which is about a Black feminist intersectional health equity lens and how that connects to our trans inclusion efforts and what that foundation looks like and why it is so critical to everything that we are trying to create in a truly from a foundation of solidarity and connectedness. We're also going to explore some policy samples and share some highlights of those collaborative best practices. And we're going to learn specific ways that cross-departmental work and efforts have had a positive impact on this process. But one of the things I like to do, many of you have been in sessions throughout the day, including your day jobs or night, depending on where you're existing within the globe. And I'll take the next slide, Jenny. So I just like to have a moment for folks to really spend a second and think, what has it been like for you to be someone when you have felt connected, when you have felt seen, when you have felt heard, and a part of your workplace? So someone that has been kind to you, welcomed you. I would love to hear words or phrases or just one idea at a time through the chat to get a sense of what is it like for you when connection happens in the workplace? I know for me, that means that I can exhale a little before I'm doing good work. I know that it can also mean that I feel like I can trust and really collaborate with some of my coworkers. And is anybody willing to share in the chat, or is one of my co-trainers willing to hop on and tell us a little bit about what connection feels like to you in the workplace? Thank you, Shinli, talking about feeling included, feeling warm and expansive. Sense of ease, that sense of just, again, the breath and settling into one's day. Valued, appreciated, feeling more secure and appreciated. Thank you so much, folks, for sharing a little bit. And what I know you know we're talking about here is how we're trying to harness and create a culture of connectivity and belonging at work for all of our trans and non-binary staff members. This is a critical foundation, and all of us can oftentimes identify times when it's worked well and times when it hasn't worked well, and trying to really create, like many of our colleagues have also shared, a motivation to give my best, feeling understood, all of those aspects of what connection means in the workplace can be such a place of strength and the opportunity to do work in our fullest sense and show up in ways that let us feel like we are whole in our workplace. And I would like to turn it over to George now to spend some time talking about our current state and our future state and what we define as our anchor in this work. George, it's all yours.
Thank you so much, Maureen. I am mindful that we all have different learning styles, and so I'm going to try really hard to not read everything that is on the slides, but I want the slides to be up, of course, so that you could follow along if that's useful for you. And certainly, I'm going to go off script a little bit in terms of not reading everything, but I do want to just keep us in the conversation. So when we think about what our current state is and how we got to this work and sort of where we were for Planned Parenthood, this was a journey that's been a part of our mission for a very long time. I mean, the organization is 105 years old. For many people, Planned Parenthood is a household name, certainly irrespective of politics, which we're not discussing tonight in this conversation. It certainly is a name and an organization that people hear about. And along that journey, we've always had as our mission healthcare and equity in healthcare and providing healthcare inclusion for everyone. That's a statement we've made, care for all. We've stood behind that for a very long time. And what we also know is that that was set in a context where white supremacy and anti-Blackness existed. It's in the history of the United States. It's in the history of our organization, as it is in many organizations. It's in our systems and structures and our culture. And what it's resulted in is that BIPOC staff, Black, Indigenous, people of color staff, trans and non-binary staff, and staff with disabilities having a less satisfactory career experience. That we know. We also know that mostly white people have been in positions of power. And an interesting sort of twist on that is even when folks have senior leadership positions, we also know that we still operate within a system that is very much based in white supremacy in terms of how we operationalize even jobs where people of color or people who are disproportionately affected may sit in leadership roles, but they still sit in a context. And then we also that, again, these have been undergirded by individual and systemic models. So what we mean by that is it's not just the things that people do to each other that might be harmful, but also the systems that have done that as well. So for us, we've recognized that this is inconsistent with our values. It causes breakdowns in trust. It limits us in terms of our full potential in the workforce, and it ultimately harms the health outcomes of our patients. And it's a risk to Planned Parenthood's brand. And so for those of you who sit in corporate world or in the business factor, one of the things that we are clear about is that even as a nonprofit, we are very much committed to the values of the mission and being stewards of those resources of which many people invest in us as an organization. Next slide, please. So when we think about our future, we think about the equity roadmap and a way to consider the different ways we reach our destination of leadership in the area of embedding DEI in the DNA of the whole organization. And for us, that's a really critical piece of work, not just words that are in a nice vision statement, but very much a part of where we're striving to go. It's to institutionalize race equity and to metamorphose into an organization where equity is the DNA that drives our processes, outcomes, access, and experiences. Now, we're going to talk a little bit more with my colleague Bianca in terms of talking about equity. But one of the things I do want to say now is that we've also been working internally to think more clearly about what does it mean to even use that word when we know that there is a distinction between what's equity and what's equality. And so we want to be clear about that as well. And then our mission within the DEI team that is overarching for us is that we're developing strategies and programs that co-create and sustain building into personal development for a DEI journey, but also creating an institutional impact that fosters a DEI lens through the culture of not just the national office, but our federation of 48 affiliates throughout the country. The next slide, please. And finally, you heard this mentioned earlier, and we think it's a pretty bold step, certainly for an organization with our age and history. But we are really pulling back and looking at what is our framework? What's the praxis? And for us, it's looking at a Black feminist praxis. That's also a very US based construct. We know that, and I want to acknowledge that out loud. But what we also know is that where we operate mostly is in the United States, and that there is a history of racism and anti-Blackness that, unless we deal with it, which is the toughest thing to deal with, we will continue to have challenges in this area in terms of our full-on approach. And of course, the doorbell just rang, and I can't believe it was so loud. So apologies for that. The praxis asks us to embrace 3 commitments for looking at a transformative movement. It's building many strong leaders, it's adopting healing justice as a core value, and in combating liberalism through principled struggle. So these are the things that we've been looking at and thinking about. We're excited about seeing how that works out in practice, and I'm going to allow some of my mouth to be quiet and some of my colleagues to come in. And I am so excited to pass the mic to Bianca.
Thanks, George. Hi, everyone. So you can go to the next slide, please. In 2015, health equity was named as a strategic goal is to help standardize and to operationalize it throughout the national office and all of our affiliates. And so first we need to think about what is the actual vision for health equity at Planned Parenthood. When you think of Planned Parenthood, you're probably thinking of the different services, or maybe you're thinking of our advocacy or policy work. You might be thinking about our education as well. And so first we had to make sure that we came up with shared language that we can use to address health equity, because very often people use the word health equity and they don't necessarily know what kind of context or meaning or definition comes to their own institution. And so one of the things that I was tasked with is coming up with a health equity definition that would really encompass all of Planned Parenthood's services, as well as be representative of our staff and our patients. So our definition is still in the works, and we are trying to make sure that it is as inclusive as possible. What I can share with you is that when we talk about health equity at Planned Parenthood, we want to assure that we are actively dismantling systems of oppression that lead to poor healthcare outcomes. We want to make sure that we are recognizing Planned Parenthood as an institution that can dismantle heteropatriarchy, that can dismantle power imbalances or wage disparities or structural racism and white supremacy. We want to make sure that we're empowering others to make the best decisions about their body, their reproduction choices, and as they age, make sure that they are continually promoting bodily autonomy. You can go to the next slide, please. And so when it comes to health equity, not only do you need a definition, but you also need a health equity lens, or a way of thinking that can help you realize that you have policies, practices, operational standards that are in place that have been around for a long time and might be rooted in white supremacy. We'll be able to address these issues and start asking ourselves better questions. Next slide, please. So at the core, we want to start thinking and reflecting when we're thinking about our policies or our procedures, who's being impacted here? Who's being left behind? Who's not at the table? Look at the communities and ask yourself, who's being harmed here in keeping on with the same old, right? Very often they might say, oh, we've had these standards or procedures for a really long time. That's the way it's always been. But we really need to challenge that. That's our job. As we are trying to advance health equity at a national level and at a localized level as well. We need to be thinking about who's at the table and what kind of decision-making processes are they allowed to have? What kind of values do we have in mind? Or how can we shape our values to meet the present day world in 2021? Next slide, please. And so we also have to start thinking about how do we expand how we ask questions within our institution. So instead of saying, oh, how can we promote healthy behavior? I find that that is not a good enough question. We need to start thinking about how are we targeting the dangerous conditions and recognized land use and how that ensures healthy spaces. Or instead of thinking, how do we reduce disparities in people or populations, we need to think about how do we look at eliminating inequities as a whole, and how do we redistribute power and resources that shape our healthcare outcomes. And so next slide, please. It's a lot of personal work that needs to happen first, right? So we all have to be more knowledgeable around our identities and the identities of others. We need to make sure that we are hearing from communities that don't look like us, right? We need to make sure that we are explicit when we talk about white supremacist culture and structural racism. We also need to make sure that we are acknowledging our privileges, right? Even being able to attend Out and Equal and have this conversation with you all is indeed a privilege in itself. The fact that we can sit here and think about ways of policies and come together with ideas to address these larger systemic issues is a privilege, and we need to be aware of that. We also need to think about the biases that we present to our work. We all have these biases as individuals and as people that work within our own organizations. And how do they show up in our work? We also have to start leaning into difficult conversations. We know that Planned Parenthood has a long reputation, and that we've had, we've been associated with Margaret Sanger before in the past, and we've had leadership outwardly say that we know that eugenesis is wrong. We know that we are taking a stand against the principles that Margaret Sanger was a part of. And that was necessary for our institution to do when making sure that we are providing equitable services for people. It's not enough just to say that we're serving all people if we're not addressing our history, if we're not addressing our institution as a whole and the things that we've done in the past. And the next slide, please. We really started to ask ourselves, and I urge you all within your own institutions as well, how is your organization either implicitly or explicitly contributing to the oppression of BIPOC, Black, Indigenous, people of color, staff, as well as trans and non-binary queer communities? And I think this question here is something that we have to sit with a little bit, right? Let it marinate a little bit, because some of these answers might be really easy to come up with. And then sometimes you might have to do some introspective work on your own. Next slide, please. We have to ask, are we as institutions committed to anti-racism? Are we committed to anti-Black? How are we committed to anti-Blackness around how these identities show up? Are we just now recently awakening to racial tensions that exist in society? Are we elevating the stories of Black and Indigenous people? Are we elevating communities or involved with communities of BIPOC people? That's important, as well as looking at what's happening with BIPOC staff. Do they have high retention? Are they staying with an organization and continually growing? And the same thing goes for the queer community as well. So next slide, please. How are we addressing trans and non-binary people? How are we addressing queer communities? It's important that we are looking at the gaps that we have. How are we going to make sure that we are having a positive experience so that people can show up as their most authentic selves, and not waiting for Pride to start advocating and start showing that you are an ally, right? I think very often a lot of organizations get kind of trapped in June, where I always challenge people, we're queer 365 days a year. So you need to be continually working with the community, right? We're not just queer during June. There's plenty of days of awareness and activities that other institutions can start to address and incorporate into their programs and initiatives. And with that, I'm going to pass it on to my colleague, Brooke.
Hey, thanks. Next slide. You all get to just stare at this really fun slide while I chat with you. So talking about being queer 365 a year, that is exactly what we do on the Pride Employee Resource Group at Planned Parenthood. And I've had the privilege of being involved with the ERG for my 3 years at Planned Parenthood, and serving 2 years as a co-chair. So I'm going to talk a little bit about what our roles look like and what we've been able to accomplish at Planned Parenthood internally with our employees. So the ERGs are used as a place to find shared community and space with different affinity groups. So we have a Pride ERG, we have Black ERG, a Latinx ERG, mental health, a lot of different affinity-based groups to bring folks together, really to create community. As you can imagine, and I'm sure empathize with over the past 18 months, finding a place to have shared community has been extremely important. And we are not, that's exactly what has been happening at Planned Parenthood too. So I would say, especially during a global pandemic, some of our successes have looked like being able to create those spaces. We've had, people leave during the pandemic. We've had a lot of new staff join, and being able to bring people in a virtual way to share in community and be able to find places and spaces with other queer employees has been extremely valuable, both for holding on to the joy and resiliency of our community, but also making sure people had the resources that they need, which is sort of the other role that the ERG plays at Planned Parenthood. That is finding places and gaps to work with our partners across the organization to do exactly what Bianca said, show up as ourselves fully and authentically in the workplace, which both serves our mission and the way that we can be as employees. So particularly some of the stuff we're going to talk about today is some of the work and policies that we've built specifically for transgender and non-binary staff. And I think it's important to talk about where these things came from. Just like anyone, we've had to make progress over time. And so in looking at some of the policies and things that we have now created and we're going to talk about today have really came from the need and the voices of transgender and non-binary staff in particular at Planned Parenthood. And it kind of always starts with one thing, right, to catalyze us. And for us, it was being able to have access to bathrooms. I don't know if y'all remember working in the office, but at that time, it was a big issue. Needing to accommodate our offices to make gender neutral spaces more inclusive for everybody. Planned Parenthood was able to meet that moment and expand the facilities to make sure that people could have that. But it really did take the ownership and the agency of trans people at the organization to speak up for themselves and sort of step into their power. Since then, the Pride ERG has sort of taken that on, realizing that it can't be the burden of queer and trans staff to bring up these issues, and that there needed to be more of a wrapper of support and care that was institutionalized at Planned Parenthood. So we worked in partnership with our human resources colleagues and George Walker, bringing in some materials from other organizations that have approached this work to build a transgender employment policy. And I'll let Maureen talk about a little bit more of the policies and things in just a moment, but this was really, I think, a powerful thing here where I myself, being one of the co-authors of the policy, we were really able to take what other organizations had built and ran with it, and having a policy that was written by trans people, I can't tell you how valuable that's been. Now that it's something that's there, it's a resource and a boundary. It kind of creates the floor for what trans inclusion can look like at our workplace. And also allows us to be really specific about the things that we need, not just being trans people, but trans people working at Planned Parenthood and knowing what our unique needs are. Next slide, and I think we can talk a little bit more about the expanded policies. I'll have Maureen come join me.
Thank you so much, Brooke. I really appreciate it. So one of the things we wanted to share as we get ready to share some of the policy foundations with you is this fabulous and fierce mission alignment moment for us. Over the years, and this has been a 20-year process with work happening in our affiliates across the country, with really important work happening within the Pride RG at the national office. But when we really think and focus on the remarkable mission alignment aspect of Planned Parenthood's work, being about the critical importance of self-determination, bodily autonomy, and agency, there is complete alignment with our commitments to and our work around trans and non-binary inclusion and the efforts to create spaces where trans and non-binary people as our patients and activists, but also as our staff and our volunteers, are able to find a vocational home and a welcoming space where they can be in these spaces and really feel like we belong. When it comes to the policy foundations, we can take the next slide, Jenny. It's important for us to focus on three of them. And as Brooke mentioned, the importance of having the ERG in a collaborative and creating space and have this come from the needs specifically of our trans staff. So this was a moment in which folks were able to identify needs and gaps and create this in a collaborative manner with our HR team so that we are able to have these documents and begin a process of getting all of our people managers on board with knowing that these exist. The three that we want to share briefly about, one is a trans employment policy, the next is a gender neutral restroom policy, and then of course a transition plan that's both for the individual and the supervisor. And I'll take the next slide. Some of the things that were key for us in thinking about what mattered most about a trans employment policy, one of them was that an employee's gender identity is confidential information. Bottom line is trans staff get to choose how they engage with being out at work. So although there are moments and times in which coworkers may want to celebrate someone's full identity, that decision and how that is incorporated into the workplace is 100% driven by the individual trans person's need and desires. The reality there is no such thing as a singular experience of coming out or being out at work. Trans and non-binary people exist in an incredibly broad spectrum of what it looks like to be out at work, and whether that may mean it's as singular as I have changed a name, or I'd like this pronoun period, or if there's a larger set of needs or desires to have a conversation with coworkers. That conversation is completely about the trans person's desires and wishes. We also find that it's been very, very important for us to be very upfront and clear with staff around, we will use your chosen name, we will use your pronouns, and there are some limited legal paperwork exceptions. It's important, I think, to tell the truth that unfortunately, in the US in particular, the idea of an identity card mismatch to whether it be ID documents, insurance documents, those kind of tools that are used to access health insurance or other benefits, those can present a specific stressor and trauma for our trans and non-binary staff member. So really having clarity and the ability for people managers and HR to communicate with exquisite respect and care and dignity about when those will be used and why they're used and where they won't be, in terms of being able to respect the individual staff member. Did you have any other things you wanted to share on specifically the trans employment policy before I move to the workplace transition plan, Brooke?
Nope, I think you nailed it. Bodily autonomy and all the things, including including the way you show up for trans people at work, for sure.
Absolutely. And I'll take that next slide. So when it came to the workplace transition plan, one of the things that we found is that a lot of our fabulous people managers and coworkers had beautiful big hearts and wonderful kind brains and incredible desire to do it right, and didn't necessarily know what that looked like or meant. And so this plan and what the team created is actually recommendations and processes to support both an employee and their manager during workplace transition. And that dual audience is really critical for us. What we know is that supporting and being there and building the foundation in which our trans and non-binary coworkers absolutely feel like they are seen and heard and belong requires our people managers to be fluent and adept in what the breadth of the needs may be for our colleagues, so that we are not just waiting for people to ask for what they need, but instead we're aware of and anticipating those things so that we can plan and work together to actively create a more connected workplace experience for our trans and non-binary colleagues. So it's a template. Individual really gets to add their absolute personal desires and wishes. And of all of the things, some folks may want to fully celebrate and be out and have everybody in every meeting know. And this is a moment of joy and expressiveness and being out. Other folks may be a little more shy and reserved about this and would like to just quietly change some things in their email signature. And again, we as people managers get to navigate that with staff so that we're serving their needs and centering them in the experience of this transition plan. One of the things that we found, again, partnering with HR has been so critical, and working with our people managers and having a health equity framework and this emerging beautiful breadth of a Black feminist praxis. All of these things mean that the stewardship and the modeling and commitment to this work is absolutely critical and key. I will take the next slide. So one of the things that we've done with our colleagues in HR is they have a fantastic program, which is a training fundamentals, a DEI training fundamentals effort, which has a variety of different topics and conversations around understanding the depth and breadth of oppression and impacts and what that means at work and who speaks up and how relationships happen and what our learning as people is, all of those aspects together. And one of the elements we've added to that has been creating a welcoming and affirming workplace for transgender and non-binary colleagues. So this has been everything from the very concrete aspect of here are some of the policies and where to find them, and who you need to talk to if someone's name or ID or email needs to change, so that folks have the granular detail of how to manage this well as the meta level understanding of why it's critical in a socio-historic context, and what we know about how many trans and non-binary people may not even be applying for work here, let alone thriving once they're here, and wanting to be incredibly thoughtful of that. So we're in the process of having every people manager in the organization be trained in that 4-hour module. And then in the beginning of 2022, this will be rolled out on a quarterly basis to all staff across the board in an effort, again, to continue to kind of have the tide lift all ships in this, so that we are collectively learning together and leaning into new language and understanding ways that inclusion can live and work and breathe into our work experience in new and different ways, to really be intentional about how we include trans and non-binary folks. Brooke, did you have any thoughts or things to share, because you were just so pivotal in the creation of these documents, either on the transition plan or the training module? Because one of the things from a collaboration and a working together perspective, it was actually the Pride ERG and HR who worked together to create the content for this training. So this was vetted and conversations were had within the ERG and HR. And then HR, the whole HR team, was our pilot project, so that we were able to get all sorts of information and insights into that. But Brooke, talk to us a little bit also about other either important elements of these plans or collaborative pieces that stick out to you in the success of this.
Yeah, I really love the template. I mean, one of the first things that happened for me showing up as a non-binary person at Planned Parenthood was looking for these resources, and they didn't exist. But where I found them was through talking to other trans and non-binary staff at Planned Parenthood. So this knowledge probably exists at your organization. It's just not a policy quite yet, and it lives in the minds and the hearts of the people that it actually impacts. So if you're wondering what your staff need, I kindly tell you to ask them, because they will tell you what they need, and giving the space and the ability to act upon those needs drives a serious amount of value for both the individuals at your place and your organization, as George talked about, an organizational shift in the value that trans and non-binary staff can bring to your organization. So that was really, really pivotal. Let's see, what else is really great about this? The template is so helpful because otherwise people are just kind of out here searching, trying to figure out the pieces. So having a template so people can walk into the job day one and know what they're needing, or even before day one. One of the issues that we had that I had to experience before having this policy in place is some of our talent acquisition folks reaching out to me as a very loud and open trans person at work, asking me, hey, we have an applicant who is interested in working here, but is curious of what it means to work here as a trans person. Can you tell us, or can you like help this colleague out? So as you can see right there is a need for a policy to intervene, to be able to hold that wrapper and to really have everybody at Planned Parenthood, including that human resource person, be able to know what we are, how we're supporting trans people. And then for people who work at Planned Parenthood and may be transitioning in real time, it provides a space to go and find those resources. Because I can say, like, if you are just approaching a transition or coming out as trans, it is a lot. It's a lot to try and figure out, and to have a sort of place to work from, especially at the workplace, is super valuable and can give you maybe some ideas that you weren't sure, or some places where you didn't even think about it would show up for you. And then the last thing I'll tag on to that is the policy was great. As soon as we got it signed and delivered, we were so stoked, but we realized pretty quickly that it didn't quite matter that we had a policy if we weren't really leading with it and showing people and telling people about it. So I cannot emphasize enough how important this training is, and I'm really excited to see the impact of it. As Maureen said, we're rolling it out to people managers right now. That level of impact and being able to create a space for people to understand the policies, to ask about them, and do that personal growth within the institutional context is just so valuable. And then just think of the joy that you get to feel by knowing that if you have a trans colleague or a trans person that is working for you, you've got people in this space, you know how now have that skill set to be able to allow people to show up fully and be that person for them. So I just find the benefit of both having queer folks being able to take lead on that and show that and show what they need and be able to get that was really important. But one thing I want to say, and I think we're kind of leading into what is next, there's always room for improvement. It's kind of, if you're not there, you're not being represented. And one of the pieces that we were missing from this is all of the trans people and non-binary people that helped co-author this were white. We don't know if we missed the mark for Black trans staff. We know that there are intersectional needs that happen at the intersections of our identities, and we don't quite have that lens in these policies. So as we continue to adapt and iterate, working inside this Black feminist practice, that's going to be a continuous question that we have, that we need to, look deeply at ourselves and see what we're missing. And, to Maureen's point, is there a reason why Black trans staff don't exist more fully at our organization at this time? I don't have the answers to that, but I'm really excited to continue to work towards making our organization the most inclusive and affirming place for everybody.
I would just add to that. We were prepping for this conversation yesterday, and Brooke is kind and didn't call me out on the stuff that I got wrong, which I'm really happy about. But this is a partnership. And one of the things I'll say is, just as an openly gay man, an openly gay Black man who really rests in that identity, one of the things that came up for me was I didn't realize, and I couldn't speak to the experience of my trans and non-binary colleagues. And that's really important, because often in positions of power, people who hold, we've gotten to a place now where we have, and Brooke also reminded me that our executive sponsor, who's another vice president within the organization, is lesbian, and also identifies as Black. And so on one hand, yay! I mean, that's like the jackpot for a lot of organizations to be able to say that in leadership, you have out folks in leadership. That's not the same as saying you have out trans folks who are also BIPOC. And I think, or for that matter, in leadership. And so for us, this was something that we do know is part of our growing edge and is part of our learning. And I would just offer to my colleagues who are on the call in different places, particularly if you're in a place where you have positional authority or power, to be checked in on what you don't know, and don't make assumptions just based on, where you think an experience might lean or come from. We got started with this work around the transitional guidelines for management because of work I'd previously done. So I was like, okay, we got a starting point. This is probably good. Let's go with it. But that was for a very different context. So understanding, who's in your shop, what are the needs, asking honest questions and being humble about what you don't know is so important to this whole process. So the partnership for me was a real learning, and it was great too.
Thank you so much, George, for that. And I have always appreciated your willingness to step into that space and acknowledge where you were and where you've come in this process. And that has made a profound difference in the foundation we have to work from. So thank you for that. And one of the things that Brooke brought up that I think is really important to just again reiterate is this policy work couldn't exist in a vacuum. And as we plan and look forward, this is such a starting block of a marathon. This is not a look, we did it. This is not a hey, check, we have a trans employment policy, good for us. No, I would say, if anything, a little bit of the opposite may be true, which is I think as we are looking at this and seeing these documents, we're seeing a new layer and nuance of urgency and need that we weren't aware of at the breadth of the need before. I'll take the next slide, Jenny. One of the things that was both just profoundly remarkable in our opening plenary on Wednesday. When was it? Time isn't real. Did you know that? Whenever the opening plenary was, and hearing stories of parents of trans kids, parents of non-binary kids, what we know and we're talking about within the Pride ERG is, oh, yes, employees, yes, transitioning on the job, yes, wait, what about family members? What about folks whose young, beautiful, incredibly just richly gendered children are saying, haha, you know who I am? Here's a name I need. Here's a pronoun I need. Get it right, parents. What does that mean for us? How can we potentially step into spaces where we're not just thinking about a trans and non-binary employee from their experience as a critical starting point, but what does it look like to broaden that lens and think about how are we serving parents of, what would it look like? I know some of our friends at Bank of America have some remarkable concierge services for navigation of insurance and on-the-job transition for trans and non-binary staff. How phenomenal would it be to have a team of folks who can pair up in a mentorship lived experience capacity to help people navigate the ups and downs of what happens in that? And also, what does recruiting and onboarding work look like as we get and build our readiness to welcome more people in? So there's just such incredibly beautiful work for us ahead and what we can do with this, but it really is a continual beginning as opposed to any kind of ending, that we're just learning so much about the needs and the possibilities for us when we really look from a solidarity perspective in terms of all of the ways this serves so many people. And one of the things we'd like to share about briefly before we tell you about our resources and open up for a Q&A is, I'll take the next slide, Jenny, is one of the conversations that's been throughout much of this building, definitely in conversations with Brooke and Alex as we built the content around the training modules. But as we were deciding, what did we want to include and tell people the stories about, Yes, we know that the struggle is real. We know the discrimination, stigma, bias within the workplace is real. We know that people step away from workplaces because of the embodiment of that stigma. But here is what we know: being trans isn't the problem. The problem is with the bias and stigma and discrimination. And one of the central things we can do to help shift the narrative is to also acknowledge the profound resilience and joy that is the beauty of transness. Resilience because we know that the number of trans folks who drop out of high school is some of the highest in terms of subpopulations in the country. But you know what else we know? We know it is the highest single data set to go back and get their GED. That's resilience. That's success. That's a part of the conversation. And we can't just hold ourselves to the traumatic, dramatic, and really difficult, real lived experience sides, but we need to imagine bigger and better. And we need to acknowledge and support and celebrate trans joy, the finding of me, the living in me, the who people are, and really unapologetically saying, yes, I matter, I belong here, I am loved, I have love, I am filled with this joy. It is critical for us to make sure that each of these pieces live in our workspace, and not just the, oh no, how don't we hurt people, but oh no, how do we celebrate the greatness that is trans and non-binary beauty and breadth. And I know, Brooke, you have words on that too, my dear friend. Do you want to say some?
Yeah,
We feel it.
laughing.
We feel it.
I'm laughing at the sun coming in, and we're talking about
I know,
trans joy. And I'm just gonna go ahead and sit in
know.
the sunlight and just pretend that I planned that, because yeah, it is. This slide is all about me, and you get to see my trans joy now. But what
Yeah.
this can look like, just as an anecdote to share, like these policies really do impact individuals and can be a really positive thing. From working through this policy, I myself went through a gender affirming surgery at Planned Parenthood, and my personal attachment to that and what I got to experience was what I wanted to, which was joy and celebration. Knowing and working with my colleagues in human resources, knowing I had just the bare minimum of what I needed to be able to get that surgery that I needed. For some people, that is even a barrier to being able to access that care. It's actually a huge barrier for a lot of people. So just sitting in that, I had that, but beyond that, I was able to talk and speak with my colleagues and just celebrate and sit in my joy. I got to tell them, hey, when I'm out on medical leave, you can talk about this because it is an exciting and wonderful thing for me. And I get to show up more fully and at work. And that has been able to impact me very positively, impacts our work very positively, allowed us to be exactly who we are and walk our mission in real time, so to speak. So that's my personal centering of joy and how these policies can look like. And I just invite you, as we talk about these resources, to please take a look at them, because not only do you get to do what is the hard work in unpacking these things and learning and growing, which is always a challenging thing, but you get to be a part of somebody's joy and be a part of, while the trans community is resilient, we'd love a break. So give us that opportunity to breathe and show up fully at work. And you have something to learn from the resiliency of this community for sure. So I appreciate the space for that.
It reminds me of the other session today around queer leadership. And we know that actually queer leadership's better. Queer leadership is actually broader.
Yeah, I'm a little biased in that, but yeah, I feel that.
Right.
I'm feeling that.
we can live into the just the breadth of who we are as folks. So I will take the next slide, and thank you so much for that, Brooke. So the next slide is just going to make sure that you are well situated to know where stuff is. So we have 2 PDFs for you. One is going to give you a bunch of information, both some of the framing equity questions questions that you're making sure to inquire about and ask when it comes to thinking about this work, as well as some of the details around the plan. What does it look like? Here are the steps, and a fabulous document that is about assessing policies for equity. And those are all available to you for downloads. You do need to go into your own login and hop on the files section of this specific workshop, and ta-da, download them, share them freely. And let's see here, we are going to shift now. We have 9 minutes left for some questions. And it looks like Highland, I hope I am pronouncing your name correctly. Question: at my workplace, we have really only doubled down and committed to racial equality in a big way just this last year. And it looks like there might be some more conversation there. We have adopted a race first approach. How do you think we can lift up issue? Well, you know what? I love that question so much. I know that Bianca, you have words on this because this is work you do in a beautiful and complex way. I think the bottom line is because race first is right and good and correct, and the breadth of experience means that we have beautiful and wonderful Black and brown, trans and non-binary folks, queer folks, LGBT folks. This is not an either or conversation. This is about lifting up the critical work of equity from a race lens and broadening it so that we know that all of those beautiful things exist. Bianca, say more, because I know that this is a core of your brain and heart.
Absolutely. And what I want everyone to understand is that all oppression is connected. So when we're thinking about race, we also need to be thinking about gender variant people. We need to be thinking about class. We need to be thinking about people's citizenship or immigration status. All of these things are connected at the same time. And we know that people just don't show up with one of their identities, right? It's not enough to just focus on one identity at a time. People are complex and they're allowed to be, and that's a beautiful thing, and we celebrate it. So we need to make sure that in addition to race equity, which should definitely be the foundation of your work, that you are also lifting up different identity groups that also have historically been and purposely been left out and under-resourced and understaffed. And so, like Maureen was saying, yes, and it's important that we make those connection points, because using Black feminist practice, and I see the quote here from my good sis Audrey, right? There's no such thing as a single issue struggle because we don't live single issue lives. Can't say it any better than that. Thanks, Jenny, in the chat.
Thank you so much, Bianca. And yet, when we think about one of the ways that when we think about creating training and programs, one of the tools we use as a concrete development tool is thinking through user profiles, right? Who are we teaching and who are we trying to teach them about? And when I think about who I am teaching and training about for my coworkers, I'm thinking about a lesbian single mom who's Puerto Rican. She lives with her mom. She doesn't have a car. She's amazingly skilled at graphic design and one of the best designers we've ever had on staff. And so I need to think about the breadth of her and her skills and amazing things, and some of the barriers that institutional and organizational barriers are going to put in the way of her being her best at work. And that means that I have to pay attention to her being a single mom. That means I have to pay attention to her being a Puerto Rican lesbian. And that means I have to pay attention to all of the pieces that she brings into her work experience, so that, again, yeah, it's not that one thing. It's so fantastic. And are there other questions? We have 5 minutes left, and we would be glad to thank you, Phoenix, for that. Boy, we're right on cue, my friend. That's great. We would be incredibly glad to share anything more with you in these 5 minutes, because I have a brilliant team of colleagues with us. You also have access to our contact information, and my email is on the PDF with the notes, and I'm happy to connect you with any of these wonderful folks. Anybody else want to either hop on a voice or text in a question? Chloe, thank you. I love the idea of planning for that hyper marginalized person as a default rather than the exception. And yeah, the only friendly amendment I'd add to that is also, like, hyper joyous and hyper filled with possibility, but dealing with the external barriers that make life harder today. That getting up and showing up and being a human means that the world decided not to set up for her. And we got to do better by that. We have structural work and systematic work to do to unpack and build. I love that, Chloe. Thank you. Oh, I can't.
Marina, I'm sorry to interrupt. I just wanted to share that even though you're about 4 minutes out, you do have 10 minutes that Zoom will give us. So if you wanted to extend it a little bit, you have those extra 10 minutes.
Great. Thank you so much. And Heidi asked a great question, and either Brooke or George, I'm going to toss it to you, I think. How long has the ERG been in existence, and how did it start down this path?
You want to start, Brooke, or you want me?
Well, do you know when it started? Because it certainly
Yeah,
didn't start when I showed up, but.
I want to say it did, just with you. No, we actually started on the journey for having employee resource groups about 5 years ago, which was about 2 years before I started. And in October of 2018, I started officially as vice president. And when I started, we were at that point sort of bringing all of our different ways that we had been doing equity work or diversity and inclusion work together in one department. Specifically for the Pride ERG, it was one of our early groups. Surprise, surprise. It, along with a group for our Black staff, were early in the history. And it kind of falls with the way that usually it happens within organizations. They started as affinity groups. They started with nominal support, nods on different things that were big picture items that the organization wanted to be supportive of. It was only when we began to institutionalize the work as employee resource groups. And one of the things I also just want to highlight is that in making them employee resource groups, what we were saying is these groups have charters. They are a part of the organization. They work with our colleague. There's a director on my team who works directly with all of the ERGs to ensure that they also get executive sponsorship, so that there is someone who is paying attention to them at the senior parts of the organization. And while they do have fun and they have joy, this conversation we're having today is a direct result. I don't know why the words wasn't coming to me. A direct result of where affinity groups that became ERGs actually were looking at the business case of why we do the work. So it wasn't just, this is a good idea, this was mission critical. And it's something that we continue to evolve, even as we're thinking about leadership and what we ask of our leaders within this space. Certainly over the last year, our employee resource groups have, like most organizations, have just really gone through a big transformation. And one of the things we're also looking at and very proud of is the intersectional lens by which we want all of the work to go through. So
that's a perfect closure piece, George. I do want to be respectful of people's lives and time. We will wrap at 7. And I think I'd just like to close with one appreciating my colleagues, because truly, what a remarkable group of just brilliant, thoughtful, and insightful humans doing work to create spaces where we all are lifting up together. So thank you so much, George, Bianca, and Brooke. I really appreciate it. And Jenny behind the scenes, just fantastic. And to all of you out there, this is a relatively new ERG. There are needs within our staff, and the simple act of asking and listening and finding your curiosity and making sure that you're not limiting yourself to what can be in existence, because folks really need this. And this is a transformative opportunity for a business and an organization, as well as for some remarkably brilliant staff and leaders within your organizations and businesses. So thank you so much for being at this amazing workplace summit and for showing up to spend some time with us. And please find us and please have conversation with us, because we all do this better because we're lifting that together and we all bring different resources and pieces. So thank you kindly. And Phoenix, you made this flawless and easy for us from a tech backend perspective. So huge thanks. Great appreciation. Take care of yourselves, hydrate, get some rest, whatever it is you need to do to be well. Take care, everybody.
Yes, I like to echo. Thank you so much for the team for this session. Thank you all for presenting this. Well done. Great information, great resources. There was a lot that I heard, but one of the resounding things I heard was about the concierge service when it comes to trans and other folks. So, and Bianca, you know, I had to say preach a couple of times while you were talking. George, you gave great information as well. And Brooke, thank you for your vulnerability and sharing your story. Just wonderful. Jenny, awesome as well. So on behalf of Out and Equal, thank you, thank you, thank you. And looking forward to hopefully you will enjoy the rest of the summit.
We sure will. It's been remarkable. Thank you. Take good care,
Thank you.
everybody. Thanks, team.
Bye-bye.
Bye.